Dear colleagues, welcome to Oncology Here and Now, an Onco podcast. Today, we focus on prostate cancer and have the great honor of speaking with Mr. Tyler Kratzer, the lead author of the recently published paper, Prostate Cancer Statistics 2025 in CA, a cancer journal for clinicians. OncoAlert is, of course, a very proud partner of all American Cancer Society journals, and Tyler is an associate scientist in surveillance research at the American Cancer Society, and we are delighted to have him here today. Tyler, welcome to the webcast.
Thank you very much, Gil, for having me. I'm really excited to be here today discussing Prostate Cancer Statistics 2025.
Okay, Tyler, so let's dive in. No better way than to look at the big picture. Prostate cancer survival is very high overall, yet the number of men diagnosed with advanced disease is rising. What could be the possible main reasons for this paradox?
So prostate cancer survival is very high overall because despite the increase in advanced stage disease, 83% of men are still diagnosed with localized or regional stage disease, for which survival approaches 100%. For those men diagnosed with distant stage disease, however, 5-year relative survival is only 38%. So these increases in advanced stage disease are concerning, but they have yet to make an impact on overall survival.
Excellent. Thank you very much. Now let's discuss disparities. The data shows persistent and striking racial differences in both incidence and mortality. What do you think are the most important steps, medical, social, or policy-driven, that could help close this gap?
It's important to ensure that every patient has access to high-quality, guideline-concordant, and curative intent treatment. A major finding of our study are these persistent disparities that you mentioned, including higher mortality for Native American men despite lower incidence. Additionally, Black men have 67% higher incidence compared to white men, but mortality is about twice as high. This is partially because Black men are more likely to have more aggressive disease, but that doesn't fully explain the mortality disparity. As of now, research shows that compared to white men, Black men with prostate cancer are less likely to receive guideline-concordant treatment and are less likely to be treated with intent to cure their prostate cancer. Part of this is less access to high-volume cancer centers. Importantly, research has shown that when Black and white men with similar cancer are treated equally, they have equivalent outcomes. So at a high level, it's important to increase access to high-quality care for everyone. Additionally, despite their high burden of the disease, Black men are underrepresented in clinical trials for prostate cancer treatment. As part of the IMPACT initiative, the American Cancer Society is working to improve clinical trial access for Black men with prostate cancer.
Indeed. But as the years go by, it seems that younger men are at risk. We're seeing more advanced prostate cancer in men under 55. Should younger men rethink when to start the conversation about prostate cancer risk and screening? What are the reasons we are seeing this younger advanced prostate cancer trend?
Advanced prostate cancer is increasing among men of all ages, which makes access to prostate cancer screening even more important. Patients should talk with their family members to learn about any history of prostate cancer, and then have a conversation with their healthcare provider about if and when screening is in their best interest. This conversation could happen around age 50 for men at average risk, but for Black men and those with a father or brother who had prostate cancer, this conversation should occur earlier, at age 45 or even 40 for those with multiple close family members diagnosed with prostate cancer before the age of 65. Because the causes of most prostate cancer are unknown, we can't definitively say why advanced stage disease is increasing in men of any age. However, for men of screening age, declines in PSA screening following recommendations against it may partially explain the increase in advanced stage disease, as well as improvements in staging.
Excellent answer. Now looking ahead in the field of prostate cancer, with new technologies like MRI, genetic testing, and more precise treatments, what do you think the future of prostate cancer detection and care will look like in the next 5 to 10 years?
Advances in disease management have already caused prostate cancer care dynamics to change. Many men diagnosed with non-aggressive early-stage cancer are now being treated with active surveillance, which is also known as watchful waiting. This can delay or even avoid more aggressive treatment options, which oftentimes have significant life-altering side effects. This helps to reduce the harms of overtreatment associated with prostate cancer screening. Genetic testing also allows patients to more fully understand the risk, which can help them make more informed decisions around whether screening is right for them. As to the future, I can't really speculate on that, but I really hope for more progress against the disease. especially late-stage diagnoses.
Could not agree more. Well, there you have it, folks. Some great insights into the status of prostate cancer in 2025 in the U.S. from Tyler Kratzer from the American Cancer Society. Thank you very much, Tyler, for joining us today. A huge thanks to the American Cancer Society and all of our partner journals for their support, and thanking our colleagues for their support and for listening to Oncology Here and Now. Until next time.